we usually don't talk about as it relates to um, humanitarian crisis. Usually our focus is on first responder, our focus is on food and non-food items. So for today, we are advancing localization effort to improve SRHR in humanitarian setting. Localization recognizes the importance of local actors in leading and designing situations that impact their own communities. For sexual reproductive health actors working in humanitarian setting, localization is critical to ensuring emergency preparedness and response efforts are responsive, innovative, leveraging the expertise and voices of women, girls, and general non-conforming people most affected by crisis. I am Naomi Tude Sholanke. I am the founder and executive director of Community Healthcare Initiative, a local organization in Liberia. I'm also one of the founding members of the NIA network. The NIA network is a network of emergency aid responders, and we were given birth to during the 2016, the World Humanitarian Summit. That's when we launched this network. And it was established mainly to recognize the effort of local actors in the South, the work that we have done that goes unrecognized, the effort, the contribution that we bring to the table as local expertise that is never recognized. We felt there was need to shift the power, and in shifting the power is to actually put the people who are already affected by the issue into the driver's seat. However, over the years in Liberia, my work, we have worked tirelessly to improving and strengthening health systems and ensuring that sexual reproductive health and rights is considered a right, as it is a fundamental human rights issue too. However, during humanitarian crisis, we lost balance of sexual reproductive health and rights. Before humanitarian crisis, sexual reproductive health and rights in development country is already a crisis on its own. So when we are into the crisis move, like in COVID response, it's doubled the impact. We see a lot of increase in maternal death. We see increase in childhood diseases. We see women being denied access to the commodities. And we see it as a very big barrier in girls and gender not conforming people accessing services that are supposed to be provided to them in the heat of a pandemic. And the COVID pandemic is not an exception to what we are discussing right now. What we are going to be doing today, we are going to be listening to dynamic panelists of women who have worked tirelessly into the country. As it relates to our panel, will be sharing findings from a program partnering with the government of Egypt to make the national public health system more resilient and receptive to Syrian refugees. We are going to be discussing a successful model for emerging women and adolescents with disability in sexual reproductive health and rights programming. We are also going to be learning or listening to a collaboration with 5 women-focused civil society organizations in Lebanon, aimed at providing them with access to the platform, people, and the resources needed to sustain and expand the network. Before with no further ado, I will now turn over to our panelists where they are better positioned to introduce themselves. Our first panelist that I'm going to call to introduce herself is Ms. Mahad Bibawi from Pathfinder International Egypt. Please excuse me if I don't pronounce your name correctly.
No, that's fine. Good morning and good afternoon, everyone. This is Mehi Bibawi, Project Director at Pathfinder International in Egypt. I've been working with Pathfinder International for 14 years in programs coordination and management. During my journey with Pathfinder International, I worked on several projects with varying sizes and complexities. And I would be happy to present to you one of our projects today. Thank you.
Thank you. We will also be asking Sudani. I don't know if we're able to get her on.
I think she's been having trouble signing in, so I think let's see if she can join us, and I think we can introduce Rita and Anjali.
So we will now move over to Rita Nami. So please introduce yourself.
Thank you, Naomi. Hi, I'm Rita Name. I am the Senior Associate for Humanitarian Advocacy at Women Deliver. And I manage, along with my colleague Anjali Roan, the Humanitarian Advocates Program, which we'll be presenting on today. It's good to be here. Thank you.
Thank you. And we go straight to Anjali Roan.
Thank you, Naomi. My name is Anjali Roan. I'm the manager for humanitarian communications at Women Deliver, where I support in using communications efforts to help elevate the voices of women-focused CSOs in Lebanon and beyond.
Thank you. So we'll then move into our presentation. So for Rahim, she's going to be presenting to us on the mainstreaming Syria refugees in the Egypt public health system. Over to you.
Hi again, everyone. Today, as Naomi mentioned, I would like to present to you one of our projects that was a pilot model for mainstreaming Syrian refugees into the Egyptian public healthcare system. Next slide, please. Yeah. The pilot project was funded by Ford Foundation in Egypt and was conducted in 6 of October City, a suburb located 45 kilometers outside of Cairo. Pathfinder chose 6 of October City because there are so many Syrian refugees in this community that some parts of it are dubbed Little Syria. Next slide, please. Because Syrian refugees are urban refugees, which means that they are integrated into the community in Cairo, there are some challenges. The first challenge is ensuring that the target community is informed about the services available to them. As much of the time the resources are there, but because the refugee community is not aware of them, they are not able to use them. And the second challenge is the potential tensions between the host community and refugees, because host communities often feel that refugees are straining scarce resources. On the other hand, because the Ministry of Health uses its own facilities to provide services to refugees, they sometimes need support on how best to address their needs and also on how to speak to refugees to build a relationship of trust. And they also need capacity building support so that their resources are not stretched. Next slide. These challenges can result in a decreased quality of service provision to both communities, potential conflict between the communities, and the deterioration of staff morale, quality of care, and clinic trust. Also, it can result in increased expenses for refugees who seek out private clinics to attain the quality of care that they need but cannot get at the Ministry of Health facilities. Next slide. In our intervention, we selected one family health facility in one catchment area in 6 of October City to pilot the project. The catchment area served a community of 700 to 800 families. In fact, the concentration on one catchment area and one facility allowed for a greater perceived impact. We all know that humanitarian healthcare interventions are usually offered exclusively to refugee communities, but because this project targeted refugees that lived within the host community, it also targeted and addressed the needs of all stakeholders in the process. This included Syrian families, Egyptian outreach workers, Syrian outreach workers, facility staff and board members, and also the Ministry of Health Governorate and district supervisors. The aim of the project was to improve the capacity of the facility so that it could better serve both refugees and locals, and to ensure that Syrian refugee families were aware of the services and felt welcome at the facility. Accordingly, we focused our intervention on health awareness and capacity building. Pathfinder tailored and conducted different training programs for facility staff, facility board members, and governorate and district supervisory teams. Pathfinder also recruited and trained Syrian outreach workers to receive refugees at the facility to overcome language barriers. Because although Syrians speak Arabic, they speak a different dialect than Egyptians. We also made sure to include Syrians in the facility boards so that they would gain a sense of ownership. Next slide, please. As for the health awareness, in this project, we managed to increase health awareness among the refugee community, which we saw was critical for a displaced population learning to navigate life in a new country. We also improved the quality of services for both the host community and for refugees, and we were able to demonstrate to the host community that health facility could serve refugees without compromising quality of services to the community. It's also good to mention that refugees were more comfortable receiving care in the facilities because, as I mentioned earlier, we recruited the Syrian outreach workers to work closely with them inside and outside the facilities. On the other hand, the host community did not feel threatened by the intervention because it did not affect the quality of services that they were receiving, but in fact, it lowered the tension between refugees and host community by showing the host community how resources could be expanded rather than stretched to accommodate refugees. Next slide. Through our project, 273 Syrian families were served and over 1,600 home visits were conducted with an average of 6 visits to each family. Next slide, please. As for the capacity building, at the facility level, we strengthened the capacity of clinic staff to enable them to balance the needs of both communities. Pathfinder trained 20 physicians, 11 nurses, and 10 facility staff members. The training program's duration ranged between 2 to 8 days. And what was special about the physicians and nurses training is that in addition to the family planning and reproductive health training packages, it also covered other important topics like identifying and referring psychic trauma cases and establishing family files. As for the facility staff members, they were trained on managerial skills, including problem solving and managing change, planning, resource mobilization, and addressing obstacles. Next slide. As for the capacity building on the Ministry of Health level, it included supporting the Egyptian Ministry of Health to better serve the community and overseeing service provision to the refugee community through training 10 governorate and district supervisors at the Ministry of Health level, along with 9 board members. We also made sure to transfer the knowledge and skills as well as lessons learned from the project to the Ministry of Health so that they could replicate the project elsewhere. Next slide. Through the project, 10 Syrian refugees were trained. 8 of them were recruited as outreach workers and trained to provide better services and support to refugees. And 2 of them were trained to receive refugees at the facility, as I mentioned earlier. The caseload of refugees at the facility increased 7-fold, increasing the number of Syrian families with family files from 54 to 125. Also, the facility quality score rose to 85% and client satisfaction was reported 95%. It's also worth mentioning that this model was recognized by the UNHCR for replication and scale-up and used as a flagship to mainstream refugees into the Egyptian public healthcare system. Next slide, please. And finally, I would like to end my presentation with a quote by one of our Syrian outreach workers called Fatia. She says, "At first, most of the Syrian families I supported were reluctant and suspicious about the quality of services they would get in the health facility. Having Syrian outreach workers in the clinic made it easier for them and built trust. And that was exactly what Pathfinder International aiming for since the beginning of this project." Next slide. Thank you.
Thank you, Mahi. Thank you so much. You couldn't have overemphasized how a local intervention was able to reach up to over 1,600 plus households, consisting of more than 6 visits. That's not only there, we all know how access to information is a life-saving tool, especially during humanitarian crisis. When you don't know where to go, when you don't know where to access services, there's a big gap. And you and your team were able to access make people to access those services, and not just making them to access those services, you're able to build capacity of trained health professionals that were able to tend to the improved quality of services, and this is what we need. Before we go to our next presenter, I will talk to our attendees that if you have questions, we will be picking questions for our Q&A section. So please feel free, ask as many questions. Our panelists are willing to answer questions. This is a learning space. So what you don't understand during the presentation, just go into the Q&A. We have a section for them. We're going to read the questions in individuals or panelists that these questions are directed to will answer. Okay, I will now reach out to Rita and Angelina. And Angeli.
Great, thank you. Next slide, please. Thank you everyone for joining us. We will be speaking a little bit about Women Deliver's Humanitarian Advocates Program, which seeks to shift more power and resources to women-focused civil society organizations, or CSOs, in Lebanon. Ignore the construction noises behind me. Next slide, please. Before we begin, we did want to just say a few words about Women Deliver's work to become an anti-racist organization. As some of you might have seen, recently multiple previous and current staff have shared via social media experiences of racial discrimination and inequality at Women Deliver. And we want to be transparent about our process to really take into account what they've said, learn from those experiences, and become the kind of organization that can do justice to their courage and, of course, that of our partners. Part of that transparency includes sharing what we've learned, which we welcome you all to see on the website on your page. And part of that work includes finding opportunities to shift more of our power and our resources to women-focused civil society on the ground, which, as we've heard, are real leaders and experts in humanitarian settings and beyond. Next slide, please. So just to begin with some background on gender and localization, we know that there's been a huge growing movement behind gender transformative localization, but there are still significant barriers that stand in the way. That includes limited access to funding for women-focused CSOs in humanitarian settings. We also know that they can still not meaningfully engage in humanitarian decision-making that affects their work and their lives. On the ground, there continues to be limited coordination between women-focused CSOs and international actors. Additionally, when capacity sharing opportunities do exist, they often favor international agendas over CSO priorities. And finally, across all of this work, there continues to be insufficient accountability to these important actors. Next slide, please.
That's why Women Deliver created the Humanitarian Advocates Program to really get at those barriers. And the Humanitarian Advocates Program is a real partnership with women-focused CSOs who are first responders, service providers, and community leaders in humanitarian settings. And through this program, these organizations receive capacity sharing, which are tailored trainings for their needs and their priorities on advocacy, communications, fundraising, or any thematic or issue area that they see fit. We also provide speaking opportunities. We know that access to global and even regional humanitarian policy meetings and conferences are quite exclusive sometimes. So we try and navigate that process on their behalf and facilitate their speaking opportunities to share their expertise during these key moments. Of course, media support to really highlight the work that they're doing through digital media, op-ed writing, and media interviews. And finally, campaign mobilizations. The CSOs that we work with have their own advocacy campaigns, and they really need support, whether it's strategic input, coalition building, or supporting through generating media attention. Next slide, please. And for a number of reasons, humanitarian needs, of course, we decided to pilot the program in Lebanon. And here are our Fab Five, as we call them, the Lebanon Family Planning Association for Development and Family Empowerment, Women Now for Development, the Marsa Sexual Health Center, the Palestinian Women's Humanitarian Organization, and the Lebanese Women Democratic Gathering, or RDFL. And you may have heard our partners speak at a number of convenings, and they're powerful speakers and experts in their topics. And these 5 organizations have really collectively driven tangible progress on a wide range of issues, including refugee health and protection, sexual and reproductive health and rights, LGBTQIA+ rights, protection from gender-based violence, and political participation. Next slide.
So the support that we've had to provide to the humanitarian advocates, we've really had to stay flexible to adapt to new needs that they've articulated. The most pronounced way that this is seen is when comparing what our support has looked like before the COVID-19 pandemic and after, and also after the Lebanon Revolution, which began in October of last year, when thousands of people took to the streets in Lebanon to protest political and economic injustice in the country. So let's start by looking at how our capacity sharing support has changed. Pre-pandemic, we began by holding in-person consultations in Lebanon with the humanitarian advocates to determine what their learning priorities around advocacy, communications, and program management should be, and develop custom trainings for each organization around that. So for example, each organization expressed a desire to craft advocacy messages tied to big international convenings like the UN General Assembly and the Commission on Status of Women. So we worked with each of the teams individually to help shape what those messages could look like. At the same time, some organizations expressed interest in common learning priorities around fundraising, public speaking, etc. So we developed some group webinars and in-person trainings where everyone could participate and learn together. During the Lebanon Revolution and COVID-19, the messages, as you can imagine, for each CSO changed significantly. As a result, we supported them in developing new messages, for example, calling on the international community to fund local CSOs in a situation where banking constraints in Lebanon specifically made it more difficult for these actors to access funding. We also acknowledge that this time brought new media sensitivities for some of these organizations. For example, some organizations led by refugee women face heightened risks around visibility in this new political environment. So we had to adjust our communication strategy to ensure that we were protecting their privacy. Next slide, please. Throughout this, in all of our capacity sharing work, we really emphasize capacity sharing rather than capacity strengthening or building, because we see it as a two-way learning opportunity. Certainly, we share what we know at Women Deliver about advocacy and communications at the international level, but we gain a lot from our partners as well. And all of our events, advocacy messages, and publications on gender transformative localization have been directly guided by their expertise. Next slide, please.
And even before COVID-19 changed all of our travel plans, the Lebanon Revolution also made us think and strategize with our partners around what speaking opportunities are best for them. Before the pandemic and before the revolution, we focused on securing in-person opportunities for the humanitarian advocates at high-level convenings like the Commission on Status of Women, the UN General Assembly, ICPD, and all other key advocacy moments. And this support is also inclusive of visas of financial support, networking assistance, and securing invitations. So it goes beyond just an invite to a key advocacy moment. And we provided support to ensure that the advocates could effectively participate in these convenings, that they feel comfortable with the lingo that's ever so changing in our space, and navigating these spaces and securing media opportunities. And of course, during the Lebanon Revolution and COVID-19, a lot of this has changed. We continuously ask the partners around the support that they need, and we adjust as see fit. Now that international meetings are more limited, and based on what they said, we help secure speaking opportunities on advocacy webinars, op-eds, and virtual press visits. And to make all of this possible, we provided a tech stipend to really alleviate some of the burdens of increased costs that the organizations are paying for now that everything has gone virtual. We also recognize when it was important to step back. There is a lot happening in Lebanon in the lives of our partners, personally and professionally, and it's really important to sometimes take a step back given how swamped the partners are with their life-saving work during these dual crises, and slow down that momentum. Next slide, please. And for media and comm support, it stayed.
Et donc, pour le soutien pour les médias,
this is how our media and comm support shifted to pre-pandemic.
Voilà comment notre soutien a changé et la comparaison entre la situation avant la pandémie et après la pandémie.
Okay. After the crises, we actually intensified this work even more because it's limited in-person opportunities. It could all be done online. I'm sorry, I think the French interpreter is speaking in the English.
I'm sorry.
Apologies. So media and comms support
donc le soutien pour les médias.
The French interpreter need to log back to the French link. You are signing into the English link. Sorry, Rita. Apologies. No.
I was trying to multitask, but 2 languages in my ears is a bit too difficult for me. So I'll just move on quickly, but to say that
je vais continuer et dire que
opportunities have stayed the same and they've intensified.
Les opportunités sont les mêmes. Excusez-nous, l'interprète a beaucoup de mal à entendre.
Next slide.
Prochaine diapositive.
Another way we supported our advocates
donc,
was
une
through
autre façon de soutenir le plaidoyer, c'est avec des appels à l'action.
I'm so sorry, but the translation is being mixed up again. Can we just confirm that, sorry for this admin fluke, can we make sure the interpreters are on the right channel? We still hear the French interpretation on the English channel.
I'm on the French channel, so before I was in the English channel. Apparently, can you hear me?
Yes.
Apparently you were getting interference from both channels, and I don't know what to do about that. Let me see. I wonder if my colleague knows. Jennifer? Yeah.
Can we try again?
You want me to try continuing and see how it works? Sure. So as we mentioned, some of the common calls to action that we heard throughout some of the speaking opportunities that the humanitarian advocates engaged in was similar calls around funding, solidarity, and accountability.
Pour la solidarité.
I do hear the translation again.
I think it's a technology issue that got missing. It usually happens. This is the second webinar is happening, so I'm not surprised.
Oui.
This is some of the support we provide. Sometimes it's very difficult.
Oui, donc je ne sais pas quoi faire.
Might I make a suggestion? Can we do translation on the same channel? So Anjali and Rita, if you don't mind, to pause and then have the translation, so that maybe that's like the only way we can move forward. Does that sound like a fair thing? And translators, are you willing to do that?
Yes.
Yes.
Donc, so you want everyone to be on the English channel?
Yes, and we're just going to have to take a little bit
on
longer.
The French channel.
Yeah, the English.
Donc, I'm sorry. So.
Okay, are we ready?
Test, test.
Donc, on va faire un essai. Vous m'entendez? Can you still hear me on the French channel? Je fais un
You're
essai.
still on the English channel, apologies.
Alors, on va essayer comme ça. Maintenant, ça marche, vous m'entendez? Non. Bon. Et maintenant, vous m'entendez?
Yes.
Vous m'entendez? Does this work?
Yes. This is the English channel, though.
Yeah. Well, I've tried 3 options and I don't know what to do anymore. Alors, les francophones, vous m'entendez sur le canal français ou non? Yeah, you see, if I put myself on this channel, then the French can't hear me.
There's a comment that they hear you on the French as well.
Oh, they do. Okay.
Mm.
All right. So let's keep it the way it is now. Donc, du moment que vous m'entendez, here on the French Communication Audio Channel. Do you want to just say something and let's see if this works? Rita, would you like to say something as a test?
Sure. So Women Deliver.
Donc, voilà. No.
Yeah.
I only have 3 options here, and apparently each one is causing problems. And Rita, please say something again.
Program highlights campaign mobilization.
Le programme souligne la mobilisation. Vous m'entendez? Can you hear me on the French channel too?
We hear you on the English. So we have 5 slides left. Do you want me to go in English and then we just do, instead of simultaneous, you translate right after we go? We have some time.
Okay, we can do that.
Okay.
So hold on, where are we here?
So we can try doing that. We can pause with every little bit.
Let me get a notebook.
Okay. Whenever you're ready.
Okay. All right, go ahead.
Okay, thank you for your patience. So Women Deliver supported the humanitarian advocates in developing a joint call to action that called for more funding, solidarity, and accountability to feminist organizations in Lebanon.
All right, what slide are you on? Donc, vous m'entendez, les francophones? Alors, donc l'organisation Women Defend a lancé un appel vis-à-vis les plaidoyeurs dans le domaine humanitaire pour une action commune dans le domaine du financement et de solidarité.
We were planning, in October 2019, we returned to Lebanon in the hopes of launching this feminist call to action through a mural with an event that would have press and high-level leadership attending.
What slide are you on, please?
The current slide.
Okay. Donc, en 2019, nous sommes retournés au Liban avec l'espoir de lancer donc un appel féministe, un appel d'action féministe avec la création d'une peinture murale pour célébrer donc le mouvement féministe au Liban.
Demonstrations in Lebanon led to road closures and the eventual resignation of the Lebanese government. It all led to the event's cancellation, which just speaks to the nature of this work and the need to be flexible and adjust when needed.
Donc, mais à la suite, il y a eu des manifestations et la fermeture de routes et le gouvernement libanais a présenté ses démissions. Et donc, finalement, ceci a causé l'annulation de l'événement. Et ceci, donc, reflète la nature de ce travail et le besoin d'être flexible et de s'adapter quand nécessaire.
Next slide, please.
Prochaine diapositive.
One of the most hardest and challenging days for the humanitarian advocates was on August 4th, when the Beirut blast explosion ripped through the country, killed 150 people, injuring many more, and destroyed critical services across the country.
Donc, un des moments les plus difficiles pour les conseillers humanitaires était le 4 août, quand une bombe a explosé dans le port de Beyrouth en tuant 150 personnes et en blessant beaucoup d'autres personnes. Et ceci a créé beaucoup de dommages dans l'infrastructure de la ville.
In response, we worked very closely with the humanitarian advocates to highlight the needs to support women-focused civil society organizations who are responding to the Beirut explosion. And we shared this widely within our network, shared with key agencies, and presented the policy recommendations to donors in an event that was co-hosted with the humanitarian advocates.
Et donc, notre réaction a été de souligner le besoin de soutenir les CSO axés sur les femmes en réaction à l'explosion, bien sûr. Et cette réaction a été partagée avec tout notre réseau et d'organismes internationaux, y compris de l'ONU, qui participaient aussi à cette réaction. Et nous avons présenté ceci aux bailleurs de fonds et grâce à un briefing spécial avec les conseillers humanitaires.
Again, this is an example of the need to stay flexible and adaptable to new needs and to ensure that our advocacy is always grounded in the expertise of women-focused civil society organizations.
Et donc, voilà encore un autre exemple de la nécessité d'être flexible et de s'adapter à la situation et de profiter de l'expérience et des connaissances de ceux qui se trouvent sur le terrain.
Next slide, please.
Prochaine diapositive.
This is just to highlight an event that will have the humanitarian advocates next week, along with civil society organizations in Bangladesh, talking about compounding crises in their countries. And I've shared the link in the chat box.
Donc, ceci reflète donc un événement qui va se faire la semaine prochaine. Et vous pouvez donc trouver le lien à cet événement dans le chat pour accéder donc à ce lien concernant l'événement de la semaine prochaine.
Next slide, please.
Prochaine diapositive.
So some of our lessons learned, I'm sure as many of you know, in the humanitarian world, flexibility is essential. Given the constant changing realities and lives of the partners, Women Deliver had to be flexible in changing our program, our capacity sharing opportunities, and the support offered based on the partners' needs and priorities.
Donc, quelles sont les leçons à tirer de cette expérience? Comme vous savez très bien, dans ce domaine, la flexibilité est très importante, vu les réalités qui changent constamment dans la vie des partenaires locaux, dans le contexte humanitaire. Women Deliver doit être flexible et doit pouvoir changer le programme, le partage des capacités, des opportunités et de soutenir les offres sur la base des besoins, des priorités des partenaires.
And core funding is desperately needed. Women-focused CSOs are often short-staffed and at capacity. To truly strengthen their advocacy, they must feel safe in their funding and their core funding. So core funding beyond just training is needed.
Et nous avons un besoin urgent de financement de base. Les OSC axés sur les femmes, souvent, n'ont pas les effectifs nécessaires et ne travaillent pas à pleine capacité. Et pour pouvoir vraiment renforcer leur plaidoyer, les communications et leur capacité de levée de fonds, les fonds de base qui vont au-delà de la formation sont nécessaires. Par exemple, il faut aider les OSC à embaucher des effectifs locaux qui se concentrent sur le travail de plaidoyer au niveau mondial.
And ad hoc support is just as important as long-term capacity sharing. We're often approached by the CSOs to support with reviewing their annual reports or moment-specific comm strategies, or any other work that comes up on their day-to-day. And this work is equally important and valuable, and it's very much appreciated by the local partners.
Et le soutien que nous pouvons offrir à court terme est tout autant important que le soutien à long terme. Women Deliver souvent reçoit des demandes de la part des OSC pour soutenir donc le travail pour la rédaction des rapports annuels, pour des stratégies ponctuelles dans le domaine de la communication. Et ce travail est très important et très apprécié par nos partenaires.
And local knowledge really matters. Having staff members who speak and understand the local language and context and culture is essential to building that trust in that partnership and understanding the dynamics of local feminist movements.
Et les connaissances au niveau local sont très importantes. Le fait d'avoir du personnel qui parle et comprend la langue locale et la culture locale est très important pour établir la confiance et la compréhension et pour comprendre la dynamique des questions féminines sur place.
And significant logistical support is needed. And this goes beyond just providing a letter of invitation. Navigating visa processes and new environments is really complicated and complex, and they never make it easier for people that are coming from various places around the world. So support for CSOs to participate in international convenings is logistically intensive, and we need to account for that time and that staff on our team.
Il est aussi important de fournir du soutien au niveau logistique, par exemple dans le domaine des visas. Il n'est pas facile, tout ce qui concerne les visas est complexe, ce n'est pas facile d'obtenir les visas, donc il faut soutenir ces efforts. Et tous les efforts logistiques pour les séminaires et les conférences internationales qui sont très intenses. Et il s'agit d'aller au-delà d'une simple lettre d'invitation.
Next slide, please.
Prochaine diapositive.
So what's next for the program? We are excited to explore opportunities to expand the Humanitarian Advocates program to new contexts. And we're currently thinking through what a scoping mission to a new geography could look like in a post-COVID reality.
Donc, quel sera l'avenir? Nous voulons donc développer davantage le programme des plaidoyers humanitaires à de nouveaux horizons humanitaires et déterminer en même temps une mission d'orientation géographique et quelle serait comment cette mission pourrait se présenter à la suite d'une période post-Covid.
We will of course continue to support our existing partners in Lebanon with their ongoing advocacy and communications needs, especially as Lebanon is recovering from the compounded crises.
Et donc, nous allons continuer à soutenir nos partenaires en Liban avec leurs besoins de plaidoyer et besoins de communication, surtout pendant cette période quand le Liban se reprend à la suite d'un cumul de crises.
We are also excited to be able to start developing a small grants program for existing partners in Lebanon. As Rita mentioned, core funding is really essential for them to be able to do this work. So excited to be able to provide those some resources to support it.
Donc, nous voulons aussi développer donc, des programmes de fonds. Nous voulons donner des fonds pour des programmes moins importants pour les partenaires existants en Liban. Et c'est pour ceci que ce que Rita a dit concernant les financements de base est si important.
And then finally, we will continue to advocate alongside our humanitarian advocates for a humanitarian system at large that shares more power, resources, and funding with women-focused CSOs everywhere.
Et finalement, nous allons continuer à faire le plaidoyer en collaboration avec nos partenaires humanitaires et pour avoir un système humanitaire dans son ensemble qui partage plus de pouvoir, de ressources et de financement avec les OSC femmes, axés sur les femmes.
Next slide, please.
Prochaine diapositive.
Here are just a few ways to stay in touch. Of course, reach out if you'd like to invite any of the advocates to speak at your next convening, and our website to stay updated about the program and learn more.
Donc voilà comment garder le contact. Vous pouvez donc nous contacter si vous voulez inviter des intervenants pour prendre la parole à la prochaine réunion. Et voilà les liens que vous voyez sur la diapositive. Ou sinon, pour avoir des mises à jour, vous avez en dessous le lien au site pour vous renseigner.
Merci.
Thank you to Rita and
Merci Rita et Angélique.
Despite all the technology issues, we were able to pull this through. Women always work better.
Donc les femmes travaillent toujours très bien ensemble.
Yeah. So for now, again, I'm asking everybody to please use our Q&A section. If you have questions, if you want more clarity, we want to say thank you to Women Deliver.
Donc, je vous demande maintenant d'utiliser donc de passer maintenant à la section questions et réponses pour poser des questions, pour avoir des éclaircissements. Et je voudrais remercier donc Women Deliver pour leur travail.
There was a lot that was said, but just few that captured my attention is one of the main one is that creating small grant for women-led organizations. We all know the struggle that local actors have as it relates to access to funding, and talk about women-led organization. The struggle is double, so that Women Deliver intervention is something that we applaud and something that we are happy as we address sexual reproductive health and rights issues during humanitarian crisis.
I'm sorry, the audio's not too great. Naomi, would you please repeat that?
Sorry, and not to complicate things, but I do see that our third panelist, Sidonie, has been able to call in and connect. and so she's one of the attendees. So perhaps we can wrap up this portion of the Q&A and then have her reconnect as a presenter, if that's okay with everyone. Apologies to all for all of the technical difficulties today.
It's okay, it's part of the struggle.
Donc voilà, Madame a dit que une intervenante vient de se joindre à nous et donc nous nous excusons pour toutes les difficultés techniques que nous avons eues. Je n'ai pas encore traduit ce que Naomi a dit car j'ai eu des problèmes techniques. Naomi, do you want to repeat what you said earlier, or should we move on to the next speaker? Now you're freezing up, Naomi. Naomi's image is frozen. I'm not hearing anything. And
us too, and we also lost Sidonie. So I think let's just continue with the Q&A.
Donc, nous allons continuer avec les questions-réponses.
I see there's a question around sharing the slides and providing emails, which we are happy to do in the chat box.
Alors, je vois qu'il y a une question qui a été posée pour partager les diapositives et pour partager aussi les adresses mail. Et donc, je vais le faire tout de suite en passant par le chat.
Okay, So let me just move forward to one of our questions before we move into Sudanese. Sudanese, welcome. Sorry that you are in the participant section, but we know you're going to get on with us as soon as possible.
Donc maintenant, je vais passer une question et nous allons passer à Soudani le plus vite possible. Pour le moment, on va passer aux questions.
Mahi, it is exciting to hear that this programming model that you presented on, focusing on supporting the Ethiopians' health system to do more responsive services to the Syrian refugees. In your presentation, you said that it has been bought by other actors, like other humanitarian actors, and going to be scaled out in other communities, in other sectors. What do you think would be necessary to ensure successful and sustainable scale of this approach?
Naomi, I'm sorry, the question got dropped. Naomi, could you just repeat the question?
Oh, the internet, oh my God.
Yeah, I know.
Switch off my video and see. Okay. I said, the question is that it is exciting to hear that this programming model that you presented on focus on supporting the Ethiopian health system to be more responsive to Syrian refugees. In your presentation, you said that it will be scaled out. It have been decided by other humanitarian actors to be scaled out in other sectors or other communities. What do you think would be necessary to ensure successful and sustainable scale out of this approach?
Donc, Mahé, vous avez fait donc une présentation très intéressante sur le modèle programmatique qui se concentre sur la réaction et l'intégration des femmes réfugiées syriennes de la part du système de santé égyptien. Dans votre présentation, vous avez parlé aussi des capacités des autres acteurs. Selon vous, que faut-il faire pour que tout ceci réussisse?
Thank you for your question. I believe I would say that involving all the stakeholders, including Syrian refugees from the very beginning, is a key to the success and sustainability of the project. Because when involving them at the community and facility assessment stages, that will help in the design of a project that is more responsive or addressing the needs of the actual needs of the refugees and the community,
okay,
which will definitely...
Sorry.
Oh, sorry.
Donc, merci pour votre question. Pour ce qui concerne donc les acteurs, il faut que dès le début, la communauté, dans ce cas, la communauté syrienne a été partie prenante dès le début pour assurer le succès du programme. Donc, soit au niveau de la communauté, soit au niveau de l'évaluation. Avec cette approche, le niveau de réussite a été meilleur, plus avancé bien sûr, car il y a eu cette participation dès le début au niveau de la communauté et de l'évaluation.
Another key for the success and sustainability is involving the Ministry of Health on all levels and in all the stages or the steps of the project, so that they could sustain the progress of the project and replicate it in other areas or facilities in the future.
Donc, un autre élément qui a assuré le succès de ce programme, c'était la participation du ministère de la Santé à tous les niveaux pour qu'il puisse répliquer et répéter cette expérience avec d'autres communautés. Merci.
Thank you, Mahi. The next question will go to Rita and Angeli. Sorry, I cannot put my video on. I'm trying to keep online. I think the video is disturbing.
Donc la prochaine question, c'est pour Rita et Angélie. Je m'excuse si ma vidéo n'est pas allumée. Je pense qu'elle crée des interférences.
There is a CSO that works in the DRC. They are asking if they can reach out to women delivered to seek
Naomi, I'm sorry, I didn't understand the ASCS, did you say?
No. There is a CSO. That's from the question asked, a CSO in Niger and DRC. They are asking women deliver if they can seek small grants from them.
No, I'm sorry, Naomi, I just didn't understand that. Could you say that again? I'm really
Hi,
sorry.
sorry, you can just look at, it's a question from the chat box. Someone wants to know if CSOs in Niger, if Women Deliver can provide small grants.
Alors, excusez-moi. Donc, vous avez la question en anglais sur le chat et la question, c'est savoir si les OSC au Niger et République démocratique du Congo peuvent faire appel à Women Deliver pour obtenir des petits fonds.
Thank you for that question. We currently are partnered with CSOs in Lebanon and hoping to expand to one more location. So unfortunately, we're not yet working in Niger or DRC, but we hope to expand the program into other settings. So stay tuned to where we go. But currently, the small grants is for the partners we are currently in partnership with.
Okay, while we are on there, before we call in Sudani to give us her presentation, I just want you to also elaborate more on these following points. During your presentation, you share a powerful example of how partnership with local organizations, such as the one you represent. Oh, no, sorry. Sorry, I'm on to another question. It was devastating to learn about the recent explosion in Beirut port and the impact this disaster has on sexual reproductive health and other outcomes for vulnerable population in Lebanon. How are these women-focused CSOs responding to this crisis? And what lesson learned from this project did they apply for this response?
Thank you. I can answer that quickly before Sidonie takes the floor. The women-focused CSOs almost immediately were on the ground and shifted their programming to address and respond to the Beirut explosion, and that was a range of supporting refugee communities that were left out from the response to actually organizing cleanup efforts to providing food and cash relief, and it really speaks to the flexibility of the local organizations on the ground, because they know the needs immediately. They are already there, they are already trusted, and they could get the work done faster than most. And I'll hand it over to Sidonie.
Sidonie, welcome to this panel discussion. I'm sorry for the inconvenience that you face. You are now welcome, given the space to do your presentation.
Okay, sorry, one small thing. Can we just double check that the interpretation perhaps may be working right now? I asked because her translator is French speaking, and so it's going to be increasingly more difficult. I think the French translation button is working. Fantastic. Okay. And let me just make sure that Sidonie is connected to the French channel. So Sidonie and your translator, are you connected to the French translation channel? Can you do a thumbs up if you can hear everything in French? Sidonie and your lovely translator, can you unmute yourself? Can you test your audio, please? Sidonie et son correcteur, est-ce que vous pouvez tester l'audio? Est-ce que vous pouvez parler? Not really sure. Let me see if I can try the bear with us. Today is a testament to patience. Okay, I'm going to see if I can communicate with Sidonie and her translator offline. I think let's move forward with Q&A while we handle that. Thanks everyone for your patience.
Thanks everyone for your patience. This is part of the process. It's the translation working right now. So if you are on besides Sudanese that is not hearing us, if you speak English and you understand English, you go down to the lower part of the screen, and there's the icon look like a map, the wall, like a little wall map, and you click on it and you click to whichever languages that you speak and understand for translation processes. Thank you. Okay, back to Women Deliver. There are a few questions here that our participants want to know. One, and this is directed to the two panelists that have spoken already. This is Makidat from Vedic health worker. And he or she is saying that all the interventions were geared towards women, while the success of sexual reproductive health and rights requires men involvement. Can you please share more about it, whether in Egypt and Lebanon, there were men involved in the sexual reproductive health and rights engagement?
Thanks,
Mahi, first.
I can go first very quickly. We know that there are traditional norms and gender norms that we have to fight against to expand access to sexual and reproductive health and rights, but we also believe that the women on the ground know how to do that best. So the women-focused CSOs that we work with are the ones who do the outreach, and it includes men and key leaders in their communities. So we put our trust in the women-focused CSOs that they know how to best involve men rather than an international organization doing so from New York. And I'll hand it to Mahi because I'm sure she has so much insight on this.
Yeah, thank you, Rita. I just wanted to mention that Pathfinder International in most cases or in most of its projects integrate gender as a cross-cutting theme in all the activities and trainings of their projects. So maybe I missed mentioning that gender and gender-based violence especially was part or was included across the activities of the projects and the trainings. And also it was one of the very strong messages that was disseminated by our outreach workers. Thank you.
Thank you. So Danny, are you okay now? Can you hear us? Not yet. Is anybody hearing Sudani? I'm not, I'm seeing her moving. showing signs, but I'm not getting any interpretation.
So I think it's a combination of very poor connection, and I'm trying to get them to unmute themselves, but it's a little bit different. Difficult. Give me.
While we are with those technical issues, we will go back again to Women Deliver. One of our panelists, Maskit, want to know that first he's thanking you for your presentation, and he's saying that what is Women Deliver experience and approach to social norms change and gender transformative approaches in the increase to sexual reproductive health and rights in 6 October, I think on the 6th of October quarter, and also in Beirut Respond. They are asking something about the 6th of October. I don't know that is a specific event.
That's,
yeah.
Oh, sorry, that's Mahi's, that's where her program is. So I'll hand it to Mahi.
Yeah, regarding the norms, actually the Syrians, the norms and are not very different than the Egyptians. So we didn't tackle this because it was not an issue in our case. Thank you.
And again, in the Beirut response, it's part of the work that the CSOs were already doing on the ground to really change perception and norms around access to sexual and reproductive health, particularly for LGBTQIA+ communities and young single women. So the work obviously intensifies after the explosion, where people don't deem it a priority anymore. So they're continuing, they've opened their centers 2 days after the explosion, cleaned up the glass, and are welcoming patients. The work keeps going.
Also, this is to all the panelists. Lena wants to know that in terms of measurement, how do you know that your efforts are successful? How do you measure progress?
Yeah, we have a set of indicators that we follow always, and we do like pre and post tests and focus group discussions and other measurements to measure our progress and the efficiency of the project on the ground. Thank you.
Sure, and with our program, success is really defined by the partners themselves. We are constantly checking in to seek their feedback on whether there has been capacity gained as a result of the trainings and workshops we put together. So we're constantly seeking their feedback for how to continue to learn and grow and improve our program based on their own self-articulated needs.
And I would just tap into those question is that from my experience being also a local actor that is directly responding to humanitarian crisis and also responding during disaster, is that the impact of measurement is visible, especially when you are working directly with the people who are affected. You see that they are taking more leadership, that it's a shift in power, they are owning the response. You see that collective effort. And you also see that after the response, these people are actually in the community to build back better. So it's easy. So if Women Deliver is working directly to partners, the impact will be fair through the community, not through Women Deliver. And I like the fact that they are highlighting how to work through partner, and this is what we want. In the NIA network, we want local actors to be in the driver's seat. Next time, I want Women Deliver to have one of the partners on this panel with them so that self can say, this is what Women Deliver, I'm doing through the support of Women Deliver, so we can be able to like shift the mark, let people be able to explain their own experiences. And these are the spaces I like when Women Deliver were also presenting how they have created and space for CSO, like acquiring visas for them, airfare. Now that we have this new shift into the global pandemic of COVID response where we are all on visual calls. I would really like to know how Women Deliver are actually ensuring that these spaces are inclusive, that local actors are on the table with the expertise and the leadership and decision are considered. How are we getting local actors to the visual meetings? I would really want to know from Women Deliver.
Thanks, Naomi. Oh, sorry, Anjali, do you want to go?
No, you go first and I'll jump in from the communication side.
Sure. We don't typically present actually on the program, so this is our first time talking about it. Usually our events are always led and organized with our partners in Lebanon, and the event next Wednesday is led by the 5 partners with CSOs within our network in Bangladesh. It's quite easy to do if we are able to secure speaking opportunities for our organization. We're always trying to push for to have the local expertise and voices on the panels as well. And as Anjali mentioned in our presentation, we have on our website ways in which you can get directly in touch with us. So anytime you're planning a meeting or a webinar or need to hear of the needs on the ground, you can directly get in touch with us, and we facilitate that conversation with the advocates on the ground so that we can ensure that they're participating in meetings that are also important to them, and not just to have a local partner for the sake of having a local partner. So I really hope that folks tune in next Wednesday because you'll hear more about the work of the advocates on the ground.
And just a little more to share how we ensure that these powerful local actors are in the decision-making spaces they should be, like you said, Naomi. As you can imagine, Women Deliver, as all international organizations, have access to decision makers directly, key donor agencies and platforms. And our role we see is really as the connector to make sure that women-focused CSOs are able to access those platforms and those moments of influence. So for example, as we shared immediately after the devastating Beirut explosion, we used our convening power to set up a meeting between key donor agencies engaged in the humanitarian response with local feminist civil society organizations that are on the ground so that they can share their calls to action, their funding needs, and the funding needs of other organizations like them on the ground. And so they could really be in the driver's seat of that conversation. And similarly with communications, as you can imagine, like all international organizations, we have access to top tier news outlets and other platforms to make sure our advocacy is heard, but it really shouldn't be us, it should be local actors on the ground. So we carve out opportunities to use our power to help CSOs pitch and place op-eds in The Guardian, in the New York Times, and in big outlets where they can really be seen. And we really work hard to make sure that their voices are front and center in all of the conversations to the best of our ability and our power.
Thank you. So Mahi, being a local actor that have this huge, innovative, responsive approach to sexual reproductive health and rights, family health, because I saw that you were also responding to family. And it's something that other humanitarian actors are actually buying into. How is this your whole network innovation? Are they considering your decision as they are moving on to scale up this innovative idea that is responsive to refugees that are in Egypt? How are you feeling your impact as a local actor?
Yeah, thank you for the question. We try to attract people by holding some social activities for the youth and women inside the Women Club of the facility. Also, we tried combining health with wealth by conducting economic empowerment activities, which had a great impact on the attraction of women to the facility. So all these activities, and also we had, there are, but in other projects, we had like, youth involvement activities, which contributed to the success and the attraction of the youth and women to the project's main activities. Thank you.
Naomi, you're muted, and our translators also are asking, the audio keeps breaking off. So if you could turn the video off so they could hear and translate correctly, that'd be great.
Yeah, I was trying to remain present, but the technology don't want us to remain present. Okay, so Dr. George has a question for us. All of the panelists he's sharing his experience in Nigeria, where there are a lot of internally displaced people in a camp called Jaw. I've been there. And he is saying that there are a lot of barriers, like their parents have stigmatization by members of the camp, and they have outreach strategy. But what is happening is that this it is less attended by young people, and he wants to know what other strategy they can employ to ensure that more young people are attaining the awareness on sexual reproductive health and rights in this refugee camp. With your experience, Mahi, is there any recommendation you can give to Dr. George to ensure that he respond in Nigeria with young people as it relates to sexual reproductive health and rights is enhanced and implemented the right way?
Yes, I believe it would be the same answer as my previous question, that holding activities targeting youth and women, and also combining the economic component to the health component would attract people and would attract youth to the main activities of the project. Thank you.
Are we able to get Sudani on, or was it successful?
No, we've lost her again. I'm sorry.
Okay, so yeah, like 10 minutes away from this amazing webinar, with all of the challenges we were able to pull through and have this discussion that is really, really important. You really don't go to webinar and discuss sexual reproductive health and rights. But I'm also going to be asking all of our panelists, besides our innovative approach we are bringing, how sustainable is our approach as it relates to access to sexual reproductive health and rights commodity. We know we can have a friendly space, we can have centers, but the availability of those commodities to the facility, how are young people accessing the family planning commodity? How are young people accessing the uses of condoms during crisis? Are they inclusive in your programs, commodities? Rita, can you answer?
Sure. Again, because we're not implementers, we work through the partners on the ground. So for example, Marsa Sexual Health Center is geared and really set up to provide these services for young people and LGBTQIA+ communities. So I think with our support, it kind of alleviates some of the advocacy that burdens that they have to go through to secure funding for these services to go on. So we try and help from an advocacy perspective to really raise their profile, to expand their networks. They have access to new donors now and new opportunities, and they have been able through these connections to secure new funding. For example, they've gotten a grant through the Feminist Humanitarian Network. They've gotten a grant from their Danish partners, the Danish donor, and they've actually partnered up with another organization in the program under that grant. So I think these connections facilitate their work, but the actual work on the ground is all them.
Thank you. And speaking of the work that they are doing, I'm going to come back and just share my experience. Um, Looking in Liberia, the issue of LGBTIQ is criminalized, and during pandemic, access to sexual reproductive health and rights services are denied them. What we have been able to do is to be able to be deliberate and find a way that we have like a mobile clinic where we have cars rented with commodities on it, and we move into community, we give them code, we don't call their name. So based on your code, when we enter the community, we're just going to say your code and we walk out of the community. That means we brought your supply. Maybe you're a woman living on HIV, you need your drugs, you someone that dependent on other life-saving medication that need to be supplied to you, but because of your own gender preference, that community had name shame you and stigmatize you. We deliberately work in those communities in a sort of way we code where they can access those services and their needs are not neglected during humanitarian crisis. So I just want to bring that all that. Especially during the Ebola crisis in Liberia, we saw there was a serious crisis on person living with HIV in Liberia. They were denied of their commodity, they were named and shamed, and during COVID, we said that this not going to happen. We found an innovative way with a mobile clinic where we need to get on the motorcycle, go into the hard to reach community and ensure that they have access to the medication, they have access to the supplies that they needed to keep safe, because health is a human right issue also. And in the last voice, would not open up for our last parting comment as we turn the floor over back to Natalie.
Great, thanks, Naomi. I am just so sad that we haven't been able to hear from Sidonie and her translator about their amazing work in Burundi, working for the National Association for the Deaf. I'm going to attempt one last time to see if we can get their audio to work. Perhaps they could just share some parting words for us. Sidonie and your translator, can you hear us? And if so, can you put your microphone on? One last good college try. And I think her video is frozen. Yes, it's so unfortunate. I actually, I know we're out of time and this has been such an engaging conversation. I really just wanted to thank you all for sharing your insights, your expertise, and for fighting the good fight in advancing localization and really teaching all of us what we can do to improve and highlight your amazing work and encourage other organizations, donors, and policymakers to better fund local organizations and advance their efforts in humanitarian settings. I see Sidonie is moving. Sidonie, can you hear us? Can your interpreter hear us? Nope. Okay. I want to also thank you, Naomi, for being such a patient and amazing moderator and for also sharing your insights into this work. I did want to give the floor to Rita and Christina Weggs, who has joined us as a participant because they have an exciting announcement on behalf of the IWAG. Rita, do you want to take the mic? Christina, do you want to take the mic?
Christina, tu veux prendre le micro?
I'm not sure if she can unmute herself.
Je ne pense pas qu'elle puisse enlever le micro.
And I think the interpretation is coming through the English again. This is really just to highlight that IWAG itself is hoping to intensify its localization efforts. And so there will be the formation and development of a sub-working group that's specialized on localization efforts, really to shift how IWAG has worked in the past and shift that power of the coalition into the hands and the work of
Rita.
Local. Yes.
I'm sorry, I'm still you're gonna have, let's try it again. I'm sorry, could you start again? est-ce que je peux parler français comme ça? Does it work if I speak like this? Vous m'entendez? Does it bleed through the English channel? Vous m'entendez?
Yes, but I think since we're at time, I'll send this up via email to all the participants.
Donc voilà, on s'excuse pour ces problèmes techniques et je vais envoyer un mail avec tout ce que je viens de dire à tous les participants.
Thank you.
Merci.
Okay, well, thanks again. We'll be sure to send out that notification around the localization task force that will now sit under IWAG. Thank you again for your thoughtful questions and participation. And again, to the panelists, to the moderators, to the translators, thank you for your patience. Thanks for this wonderful conversation, and have a wonderful day, everyone. Take care.
Donc, je remercie tout le monde et à la prochaine. Bonne journée.